Hello, welcome to another episode of Powerhouse Outlet. My name is Richard. I am the founder of Powerhouse Outlet, and today I have a very special guest, Nurse Rose.
Appreciate
I'm,
the
I'm I'm
invitation.
so excited that we could make today happen because you're such a pillar in your space. You're such a impactful being that, like, I know that having this conversation with you today will have so much value and impact in the lives of all our listeners.
I'm hoping that is actually true. Yes, I'm hoping that really does work. Thank you for
I'm gonna
saying.
I'm gonna go start with this bio and then feel free to interject and I'm going to pass it on to you right after. Okay. So,
Sure.
Arlene Rose is a board certified family psychiatric mental health nurse practitioner with over 2 decades of experience. Starting as a teen mom and a CNA at age 17, she rose, no pun intended, she rose to become an advanced practice nurse and of founder of the Rose Yarde, where she provides mental health services, nurse coaching, and wellness consulting. A first generation American from Los Angeles with roots in St. Lucia and Jamaica. Okay, okay, Gaza Gully, all right. Arlene is passionate about reducing burnout, suicide rates, mental health stigma. She's also the visionary behind Try You. I'm going to ask you what that is. A platform empowering nurses through education and mental health resources, and the creator of tools like the Side Hustle Bible. As a mother of six, entrepreneur, advocate, Arlene inspires her social media followers with content that educates and connects healthcare professionals with while building a legacy of health and wellness. Whew. um, yeah, so I just want you to take over from here. Like, wow. How does it feel knowing you've accomplished so much and you're just so cool, cool, collective, just sitting, relaxing, like, let the world know who's Nurse Rose.
Well, Nurse Rose is me.
Mhm.
First and more, most, I'm myself. At the end of the day, I'm myself. I feel like I'm cool, calm, and collected because I'm not done yet. I have so much more to do. And I really feel like I'm just getting started, to be honest with you. Mostly, that's what I would say, who I am. And at the end of the day, also, I'm human, just like anyone else.
So we gotta take the listeners to the roots. Like, where did this drive, this passion come from? Like, what was that first seed that you planted and said, "This is it, and I'm going down this path"?
Now, is that the path of nursing or the path of mental health? And from, yes,
Which
which path?
came first? Which came first?
The nursing path came first.
Okay, so can we start with the nursing and then how it led to mental health?
Yes.
Okay.
So I got pregnant at 17. I wanted to be a physician. So initially, I planned on being a physician and going to Berkeley for like pre-med. But Berkeley at that point in time, they didn't accept, pregnant women or even teen moms into their dorms. And I was a teen mom. And so I had to pivot. I found out that there was a nursing program in Mexico that I could attend, and also gain another language. And so my mom asked me if I wanted to go, and I was like, bet.
Mm,
And I started studying nursing there in Mexico. Well, actually, I was a certified nursing assistant already at that point, and that's because of my aunt, my
mm,
St. Lucian aunt.
mm.
She was like, you have a child, you got to make money, get up, work. And so I was like, I'm a nursing assistant. But then when I found out about the nursing program in Mexico, I'm like I said, I got to go. And so that's my first real like nursing education there.
So you already had nurses in the family?
Oh, yes, one nurse,
One nurse, okay.
my
Okay.
aunt.
And then that just changed the trajectory of everything. So
Yeah.
what was so impactful about her that made you listen to her over anybody else who was influencing you around at that time?
Yeah, so my mom, my aunt, or they're like best friends, were best friends. Or my mom passed away, so they're best friends, best sisters. Like they were really, really close, and they would work in cahoots. So my aunt had a way of connecting with me or talking to me that my mom could not. However, my aunt also had a teen pregnancy. My aunt also, was like the first member of our family to come from St. Lucia to be in America. And she also was a certified nursing assistant. And she, at that point, she had like three houses, big money, all her children taken care of. And so I'm like,
Mm.
she gives it a lot of good reason, right? I gotta follow her. I gotta listen to her.
It
And
reminds
so
me of, if you ever read Rich Dad Poor Dad by Robert Kiyosaki, it's kind of giving me those vibes a little bit, you know? But that's cool. Okay. So, along the journey, what led you to becoming a family psychiatric mental health nurse practitioner? Like, mhm,
lived experience,
okay.
that's the biggest catalyst, I would say. Lived experience.
So, what were some of like the most rewarding moments in the past 2 decades? Because I feel like there's so many probably to pick from.
Yeah, there are a lot. There are a lot, but I think the most rewarding for me would be the times where um, patients tell me that they were like on a brink of either self-harming or ending their own life, and they did not. And so for me, that would be like the most rewarding, those times, um, those experiences. Yes.
Okay. Okay. So, you also help other nurses, right? You empower them, you coach them. What are the challenges that you feel like nurses in the mental health space or in general, like where do you see that they are, what challenges are you seeing them face in the present day that you're like, oh my God, like this is happening? Like, like, go ahead.
I I get so surprised when I see that nurses are not aware of what they're capable of.
Mm,
Right? So sometimes I'll talk with someone and they didn't even know that they could code this for their services, or they could, see a client here or include this part of thing that they're already doing as part of their treatment. And so it's a lot of the time I see nurses not being aware of how powerful that they are, like
mm,
not being aware of their own power.
mm.
For me, that's like when I see that, I'm like, oh, I gotta tell you how powerful you are.
That's basically one of your businesses, right? Like one of this is what you help them with, right? You know?
Yeah,
Perfect, perfect.
that's what I do. Mhm.
Okay. So, how do you like, I guess, sign them on board? Like, how do you like, like, is it like consultations or do you just go, hey, I think you could use my services, like talk about your brand, talk about your business,
Sure. So believe it or not, everyone who ends up being my client, they find me. So I'm a big believer in if you curate your garden, everyone that wants to be a part of your garden will find you. So, making the right, saying the right things, showing up at the right time, staying true to my brand, true to my purpose, true to who I am, and true to my goals. That ends up helping me to find my clients. And I say that because the goal is I'm not able to do as much of the work that I can do if I'm not, other than teaching, if that makes sense. So, like, one person can do so much, only so much. But if I teach, let's say, 10 people, and then those 10 people teach 10 other people, and then those 10 people teach 10 other people, then we just have like this whole world of educated, empowered individuals that are living in their purpose, riding the wave of AI pretty much, and the new things that are coming up in healthcare and serving our communities. Where we are able to make such an impactful difference just if we can see that we ourselves are units of health. Like every nurse is a unit of health, in my opinion. And so um, how I get my clients is I just stay true to my truth.
Okay, perfect. I love that. I love that. So, with all that you guys do, and how do you avoid burnout? And is it also this? Are they the? the same things you refer to your clients, or is you got like your personal way to avoid burnout, and you
Oh
like,
no, absolutely. I absolutely, tell everyone that the way to avoid burnout is unique for everyone, but it's some core fundamentals, right? So it's taking a day off where you do something fun or like heartwarming that pulls on your heartstrings and that feeds you life to help you do the other things that you do. Exercise, eat well, cut out a lot of the negativity if that's a person, a place, a money source, whatever that is, cut it out. It has to go. And you live well. That is like one of the key things to avoiding burnout. It's in the life that we live. It's not any like secret. It's just the life that we live. So I practice what I preach.
okay, I love that. I love that. So here's a personal question because I have met nurse practitioners who are like living the celebrity lifestyle, and I've met some who are like almost like check to check. It feels like, and I was kind of shocked because I just thought like once everyone becomes an NP, it's like, so um,
That is not the case.
I know a little bit more. Like, can you like maybe
Tell you why?
tell me why, or even give advice to that person who's like, I'm barely, so like,
Yeah. So a lot of the times it's who you're working for and what are the limitations that that job has on you. So, or restrictions that the job has for you. So, for example, the average salary of nurse practitioners nationwide is I want to say between 110 to 130, believe it or not, which is a low value in my opinion. Now, there are some nurse practitioners making, upwards of I would say 250 to standard, and even there's some millionaire making nurse practitioners, and it all boils down to uh, how you're serving the clients that you're wanting to serve and also leveraging your license.
mm,
It all is about leveraging your license. So, I could have gone out and got a job, let's say, for example, working under a physician, and the starting pay would be like $65 an hour, 65 to let's say maybe $90 an hour. And that's what I'm making, period. Right? There's not any self-billing, there's not any coaching on the side, there's not anything additionally that I'm doing. I'm not selling any products that are dear to me, and that's the salary. So yes, they in this current economy with you know groceries being your toes and your fingers too cost, right? It's hard to survive in that economy.
so I guess my question is, what would you tell that unique individual, if it's like a service or not? Let me know if I'm doing too much, but like, what would you tell that individual so they can get into a better situation? Like,
Are you happy? And if you're not happy, then it is time to pivot. Yes. If the niche that you're working in does not make you rich or has any type of rich in soul, right? It's not even just financially rich, because some of the niches make us rich on our soul, our heart, our mind, our spirit, and they make you that type of rich first before they make your pockets rich. I'll be honest and tell you that because everything is building. So if you're working somewhere and it's making you like impoverished in your soul, in your spirit, then you're going to be broke, hands down. There's no way around it. You're going to be broke. Not only you're going to be broke, you're going to keep being broke because then you're not switching. So if you are working in an environment that is depleting you, it is depleting your resources, and you're not getting paid, bad combo. Bad, bad, bad combo.
so for that specific nurse practitioner that I'm thinking of, is it Indeed? Is it LinkedIn? Is it medical networking events? Is it?
If the nurse practitioner doesn't want to start their own, because some nurse practitioners do not want to start their own, then it's all of the above. It's find what is true to you, right? Like what is the spark that makes you wake up in the morning? What is that thing that you can't stop thinking about? And do that.
Mm.
tie your plan, your future plan to that one thing, or it might be two things that you are unable to put down. Like, if someone told me right now there would be zero more dollars in suicide prevention and there would be zero more dollars in coaching, I honestly would still do it.
Because you have that care, that passion, like,
I
like
know.
you hear it, I call it the fire. You have that fire in you, and that to me, that those burning desires is what lets I look for those in uh who I want to align with and who I should be a little more reserved from, so once I hear it, it's like an energy thing, so I definitely hear it with you. So what are some changes that you would like to see improve in the mental health care system?
Well, there's a lot, first of all. Um, the first biggest change that I would like to see is the um, de-escalation of a penalty with mental health, if that makes sense. So, for example, a lot of places right now, if you fill out a form, if you're a nurse practitioner or a nurse and you fill out a form, like, have you ever had a mental health illness, for example, or do you have a mental health illness that could be debilitating at any point, or are you ineligible to perform care because of your mental illness? It's like that is a discriminatory jargon, just hands down. So, of course, right, a nurse is going to see this and say no. And so because they automatically say no, right, just to get their job, they know that they cannot show up with their mental illness, let's say, on their shoulder. And so then there's that scenario where they think they have to hide their mental illness, then they have to mask. Yes, they're masking every single day. And every single day after you're wearing a mask every single day, it's hard to operate. It's hard to operate in the here and now. So the first big thing that I would like to see is the removing of the penalty of mental illness for healthcare workers, period. Nurses, healthcare workers. Yes.
So that's one. Keep going. I want to hear more because
Sure. Additionally, I would like there to be a uniform mental health addressment, like addressing of mental health for healthcare workers. Like, yes, they're saying, oh, we got the EAP program, Employee Assistance Program. Oh, okay. The EAP program, what is that? Like one session, two sessions, maybe three, and you have to kind of like get to like a dire limit before you even go to there. And then you might have to, ask your supervisor for a referral, or, you might think that it's going to be highly costly to you. You're not aware of what it is. And so I just feel like because individuals are in the healthcare area, the arena, they're working in healthcare, it should just be assumed that they're going to need healthcare and mental health support from day one. And so it's not even a secondary treatment. It should be a first-hand treatment, like a preventative type of treatment. Like, what are we doing to prevent mental health illnesses from stirring in this population? Instead of playing catch up after it appears, because definitely it's going to appear, but we wait for it to appear and then we say, oh, that person has a mental health illness. Let's ostracize them. Or, oh, they're not able to do their job because of their mental health illness. And oh, so it's that understanding that every single person in the wellness health scene also has their own mental health. And if we can remember that, then I think that would change quite a bit. So then that's one. That's another one.
I like that. That was two. I'm trying to get like three or four out of you, maybe
I can keep going. Let me keep going. Additionally, the funds, right? Mental health illnesses account for such a high cost of, let's say, disabilities, days out of sick of work, FMLA leaves, different leaves. Like mental illness, the burden of mental illness accounts for so much of these ill days at work. So because that's the case, right? It shouldn't even be like a something that we're an optional to use. We should give it to employees without it being a punitive a connotation towards it. So not only are we treating them ahead of time, we're allotting mental health care and mental health days because we already know it's going to be needed. So just like you have your PTO bucket or your vacation bucket, mental health bucket that needs to be given. And within that mental health bucket, that means we have to speak about mental health differently, right? So it's not the mental health character, right? It's the individual that has a mental health illness and not the mental health. The person is the mental health person. Like the mental health person is their illness, right? What does that mean? We're like we're saying the weather is bipolar. No, the weather is not bipolar, right? This individual is fighting through their bipolar illness, right? Or, you know, taking away the illness from the person and having the person still be whole.
Gotcha. It sounds like being more proactive than reactive, you know?
Definitely, definitely proactive because the reactive is what we're doing now, and the reactivity that we're doing now is not good.
Mm,
Definitely not good.
okay. So like I still want to stick on the like more examples, but like are you seeing that practices or more like regional, like if you go on the East Coast, certain things may be done, procedures, policies are being enforced differently than you go down south and it's one way, then it's or is it like across the board?
No. The thing about it is, the reality is that it's not a lot of uniformity. Even though it's thought to be a lot of uniformity, it's not. Yes, some individuals, some areas are more punitive on mental health individuals or mental health illnesses than others. And even we see that within the addiction space, scape, right? Where some states destigmatize and decriminalize the individuals that are suffering from, let's say, opiate use disorder, marijuana use disorder, alcohol use disorder, where other states, they still have the same type of penalty as, a true criminal with illnesses, with these are mental health illnesses. So, no, there isn't a uniformity. We would like to think there is,
Like no
right?
union or anything, like no like yearly conference of like, you know what I
Oh,
mean?
there are a lot of yearly conferences. Don't get me wrong, right? Do not get me wrong. There are a lot of yearly conferences. We all
I guess I should say like, or maybe it's just surface. Like I said, I like to go deep. Like,
surface. It is surface. We all use the same DSM-5 to diagnose individuals. We all use the same verbiage. It's just we definitely treat our mental health population different in different states. You know, some states like, oh, mental health is not really real.
mm,
Like, oh, they're not real. It's not a real problem. Even though, yes, there are others in the individual state that treat it real, the global view is still grander in some places where it's not in others. Like I would say liberal to not liberal in that same type of scene.
I feel like mental health itself is still a new link. Like it's like it's new to the algorithm of our lives. Like as much as you know, like in the '90s, people weren't saying mental health. You know, like I don't remember hearing those two words put together. You know, so I feel like it's still in its birthings. You know.
It is. It is. It's just recently being like destigmatized to the degree that it is now. You know, where individuals are able to say, I'm struggling with anxiety, I'm struggling with depression, I'm struggling with, panic disorder, and not be um, seen so unfavorably. Previously, right? Even I would say 5 years ago, 5, 6 years ago, someone says that, they're like, oh, come on, get out of here, right? So it is definitely changing. The way that the public views mental health is definitely changing. Do I think it's changing fast enough? No. Do I also think that it's changing in the right way? Sometimes I say no. And I say no because it's not a democratization of mental health, right? So, for example, where someone who has the resources, has the support, has the finances to be mentally ill, right? They're allowed to be mentally ill. But let's say, for example, you have the same diagnosis with no resources, no family support, no um, no wealth, so to speak, no time off. That person is treated markedly different than the other one. with the exact same illness. And so it's not a uniform view for that same reason. And also it's depending on who you are.
Mm, okay. So with the end of part one, we only have 1 minute and 40 seconds left. I kind of want to finish here with like the issues that you're seeing still, and then I want to do part two to just be like the changes you would like to see and just focus more on that, you know. Um, so is there another problem, like another something else you see like you wish you could improve or you wish would improve? Whether
Yes, I think
or
money. There needs to be more money for mental health.
incentives,
More
yeah.
money for mental health, definitely. I think that would be key change.
Okay. How does one go about that? Like, is it about complaining to somebody, filling out some forms? Is it, you know,
How do they go about getting more money for mental health?
a lot of times, sometimes something bad has to happen before change happens. You know, I don't know if it's like that for the medical space as well. Like,
It is a lot of the times. It is a lot of the times. Yes, like adverse events then creates more funds for mental health. Yes. The rising rates of suicide amongst the actual healthcare professionals has also driven that a little bit too.
like, okay.
So yes, there it is happening, right?
Mhm.
I just don't think it's disjointed. It's definitely disjointed.
Okay. All right. Well, guys, this is the end of part one. We have the lovely Nurse Rose. Clap it up for her, you know, because she's dropping a lot of value. I hope you guys are taking notes. I hope you guys are, tuning in. And if you're in the medical space, I know she's touching your hearts right now. So tune in for part two.